This video shows the steps of arthroscopic marginalization of thickened central portion for large posterolateral corner loss type of discoid lateral meniscus with the patient in a supine position. A 30 degrees arthroscope through the anterolateral portal to trim the edges of the TCP using an arthroscopic punch. Then, the central of the TCP is reshaped to be narrower and thinner using both a punch and a motorized shaver to reduce its tension, making the transposition easier. Next, the other side of the TCP is released the same way while viewing from the anteromedial portal. A probe is then used to reposition the TCP laterally and posteriorly to cover the lost area. During transposition, it is necessary to repeat these processes until the TCP can be easily repositioned to the lateral margin and sutured to the residual rim with minimal tension. Once the TCP has been sufficiently freed to reach the residual rim, both the outside-in and all-inside techniques are employed for suturing. First, a suture is placed at the anterior horn, serving both for tissue suturing and as a traction line to facilitate posterior angle suturing. For the mid-body and anterior horn, the previously reported outside-in technique is employed. An all-inside meniscus suture device is applied to suture the posterior horn. An all-inside lateral meniscus suture method via the posterolateral portal can be used if a secure suture cannot be achieved with the all-inside meniscus suture device.